let's say you have a situation where a patient has a right on left backward sacral torsion. A right on left backward sacral torsion. So their sacrum's facing the right on left backward sacral torsion. The right side of the sacral base would be felt to be more superficial. The left side would be forward. The right side would be back, the left side would be forward. All right? It would get worse when they go into an arch because the right sacral base can't move forward. Okay? That make sense so far? Yeah? Okay. So if I want to try and have a patient, if I want to try and correct that, what muscle could pull the right sacral base anteriorly? What muscle could pull the right sacral base anteriorly? The right, what did we say about sacral torsion is the biggest, the psoas, right? The other one's piriformis, but those are going to be the two we use, but psoas is the big one. The right psoas could pull the right sacral base forward, right? But I want it to rotate to the left. It's rotated right. I want it to go to the left and get pulled forward. So I'm going to come up with a position to do that. And that position is going to be what's called a left Sims position. All right? So Vinny, what I want you to do is leave your hips here, but lie on your belly. So now he's left rotated from the top down. His spine is biasing the sacrum to rotate left. Right? It's going to want to follow the lumbar spine. He's rotated left. Can we see that? Right? Now it's easy. How can I get his right psoas to work?
Hip flex.
I can even put my hand on the back of the sacrum, and I can say, "Hey, Vinny, keep your knee here. Don't let me pull you back further. Gentle, gentle, gentle." And we're just gonna hold against hip flexion and relax. We might be able to get a little more motion. We might be able to push that sacrum forward a little. Hold again. Don't let me pull you back. So this is a muscle assist technique to use the right psoas to pull the right sacral base forward and correct a right on left backward sacral torsion. A lot of positioning, it's a lot of anatomy, it's a lot of kind of understanding what muscles do, but does it make sense? Right? Okay. Let's look at the other direction of sacral torsions. Let's say we have a forward sacral torsion. Lie on your other side facing me. Yeah, that's fine. So let's say now he has a forward sacral torsion. So let's say he has a left on left forward sacral torsion. So the right side is forward, left side's back, but I want to pull the right side back. He's got a left-facing sacrum, so I want to rotate it back to make it right-facing. So I want right rotation. So let's create right rotation. Give me this arm. And there's some right rotation. All right. Now his lumbar spine's rotating right. Sacrum's going to want to go with it and start to correct already. We're going to use piriformis to correct it and help pull the sacral base posteriorly. If you look at your anatomy of the piriformis, this makes sense because it attaches anteriorly on the sacrum, but then comes out from the sciatic notch and attaches to the femur. It actually runs posterolaterally. It runs from anteromedial to posterolateral. So when you contract it, it will pull the sacral base, at least theoretically, it could pull the sacral base posteriorly, right? So how are we going to get piriformis to act? Well, we talked about this before in the release technique that we did for piriformis, that if you bring the leg up into flexion, you actually have the piriformis is quite active as a horizontal abductor if the leg is in flexion, right? The piriformis runs almost straight along the line of the femur if the leg is like this. So what I can do is come over here, palpate the sacral base to see if we get a little bit of movement, have him keep his legs there, and I can say, Vin, you do two things. Depending on how stiff the person is and how strong they are, he kind of hangs out there already on his own. Maybe I have to move him a little closer to the edge. But if the person really has a hard time holding their legs up, you might be holding their legs here, and you might just like the C1-2 mobilization we did, I could just say, just hold your legs up there. And if that's work for them already, this might be enough. For Vinny, he's strong, this isn't really much work for him, so I might say, don't only push your legs down. And relax, let him drop a little. Good. Again, don't let me push him down. So he's lifting up into abduction, probably some rotation, but mainly horizontal abduction. And I'm using the piriformis on this side to pull the sacral base posteriorly, because he's in rotation. That's going to tend to take the sacrum back that direction. Okay? That's good. You can stop there.